Right, good evening everybody and welcome to today's meeting of the Customer and Corporate Services and Scrutiny Management Committee, meeting in person at West offices for the first time since February, I think it was, 2020. So welcome everybody. Because we are in person, I get to do my actual housekeeping, which is to remind everybody that we are webcast and being broadcast live. We're not anticipating a fire alarm, so if it does go off, it's back down the stairs and out via the nearest exit. Toilets, I think everybody in the room knows where they are, but just back behind us through the door. And of course, mobile phones, please make sure you've got them switched off or on silent. I have received one apology for tonight's meeting, which is from Councillor Baker, and I note that Councillor One is not in attendance this evening too. Councillor Norman, we are anticipating arriving, but appears to be running a few minutes late. So if I can move us on to the agenda, and just before I do that, I should just introduce the two people on either side of me. We're joined by Rachel Antonelli, who is the Council's Senior Solicitor and Interim Deputy Monitoring Officer, and by Rob Flintoff from Democratic Services, who's here taking the notes for the meeting. So on to agenda item 1, which is declarations of interest. Do I have any declarations from anybody? No, don't see any. So on to agenda item 2, which is the minutes from the last meeting. I just wanted to tweak a little bit of wording, which was just on page 3 on the second paragraph. It says, it was noted that following uncertainty over assigned seats, I think it's probably more appropriate to say disagreement, but that's something that we're dealing with off stage, as it were. So if everybody's happy for me to amend that to disagreement. Otherwise, I'm happy to accept these minutes as they are. So if I can just have a nod or a show of hands that we're happy to sign them off as that, that's great. Thank you very much. Agenda item 3 is public participation. We haven't had anybody register to speak this evening, which means we can move straight on to agenda item 4, which is the public health update on COVID-19. And we're joined at the table, actually at the table, not a virtual table, by Sharon Stoltz, who's the Director of Public Health. So welcome this evening. And I think you've prepared a presentation for us.
Thank you, Chair. Richard, I think you're going to assist me with this. So if we can go on to the first slide. So what this does, if I can talk a little bit about what's happening on the right-hand side of the graph, first of all. As we can see, our case numbers in York, which is the red line, have been increasing slightly above the England and regional average. There is just the beginning of some indication that our positive case rates might be starting to slow down. Our provisional data, our local data suggests that, which we think is probably because we have a number of students who are returning home for the summer, and that York picture reflects the picture that has been seen in other university cities as well. I have some updated information that's come through the day. So our validated rate has gone up slightly. It's 415.9 today, which represents 876 cases. That means that we remain above the national average, but our regional average is pretty much in line with the regional average. Over the next couple of days, that validated rate should start to show the most updated picture, as I said, for provisional data, which seems to suggest that is slowing down. What that means then, in terms of the R value, the reproductive value, is that when we look at that across North East and Yorkshire, and when we estimate what that is for York, we're looking at an R value of between 1.3 to 1.6. So overall, the underlying prevalence of COVID is continuing to increase. Most of the cases that we're seeing in York are due to the Delta variant. We still have some cases of the Alpha variant, but the maximum number of cases are down to Delta, which, as we know, is more infectious, and that's what we're seeing in terms of our case numbers. Going on to the left-hand side of the graph then, that shows where York is positioned in relation to the other local authorities in the Yorkshire and Humber region. So as you can see from that, there are a number of local authorities that have higher rates than us. North East Lincolnshire, Barnsley, Wakefield, Leeds, Doncaster, all have higher COVID rates than we have in York at the moment. And just to say something about our positivity rates, that's the number of COVID tests that are coming back as positive. Our rate is 14.37% at the moment, considerably higher than the national, but just below the regional average in terms of the percentage of tests coming back positive. So on to the next slide, please. As you know, from discussions that we've had previously, we keep a very close eye on what's happening with the older age group, the over 60 age group. That shows that we are seeing a general trend of an increase in the number of COVID positive cases in older people. We're doing better in York based on our latest data compared to regional and national averages, but we're still keeping a very close eye on that over 60s rate. So on to the next slide, please. This shows within York how the case rates vary across wards. The rates look a bit scary, but if I translate that into case numbers, that will help you to put this in context. So the lower rate, Bishopthorpe there of 120.5 per 100,000, that represents 5 cases. And then the highest rate there that we can see at Hull Road, that represents 119 cases over the last 7 days. So that helps put those rates in a bit of context. On to the next slide, please. So you'll be very familiar with this slide. It shows hospital admissions. So as you can see at the right-hand side of the graph, we are seeing a gradual increase in the number of hospital admissions. We're not seeing the rapid peak that you can see on the slide there from last spring or what happened over the summer or in January. But nevertheless, a slow but steady rise. And again, that's reflected in other parts of the country as well. Our hospital data is always behind. We don't get that on a daily basis. So the most recent data we have shows that there were 15 confirmed COVID patients in general and acute beds at York Hospital and 1 confirmed COVID patient in ITU. But it's possible that those numbers may increase. I'd like to say something about the position of the hospital at the moment, Chair, if I may. The COVID data doesn't truly reflect the pressures that the hospital is under at the moment. The hospital is under enormous pressure caused by a number of associated impacts of COVID. So staff morale is very low at the moment. Staff are very tired. They're exhausted, to be honest, and are quite wary that we're at the beginning of another wave of COVID and the impacts that's going to have on the NHS. I've been in a couple of meetings today where it's been described as it's winter now in the NHS in July. We've never known it as bad as this. And so there is a real fear, I would say, for what winter may bring when the health system is already so busy, not just the hospital, but primary care as well. There are levels of staff sickness at the moment. Staff are off sick either because they have COVID or because of stress or mental health issues. And there are large numbers of staff off having to self-isolate or care for children that have been sent home from school as contacts in the bubble. So there are those staffing pressures, but there are also the pressures to deal with the backlog of elective care. So government policy is no longer to protect the NHS. The NHS is expected to deal with the backlog of elective procedures as well as deal with the very real pressures that they're experiencing at the moment, as well as preparing for winter. Next slide.
Just before you move on from that point, when you say that it's winter now, and so I tend to think of that as being flu and colds and those sorts of things impacting, but can you just give us a little bit of a flavour of the type of things that are impacting? Yes. Obviously you've said the staffing and some of those pressures.
Okay, so we expect the health and care system to be very busy in winter for all of the reasons that you've just mentioned, Chair. What we're seeing at the moment is that the NHS is as busy as it normally is in winter. And that's for a number of reasons. They have got targets to meet to catch up on backlog of elective treatments. They're trying to manage waiting lists. They are having to deal with patients with long COVID and the demand in A&E and on the hospital for routine things, respiratory infections, not flu yet, flu isn't circulating, but other respiratory infections that we normally see in winter, we're seeing now. And that is partly because people have lost their natural immunity from the viruses, respiratory viruses that circulate all of the time. So we're seeing quite a significant spike in the number of young children experiencing respiratory infections that we would expect to see in winter. And it's because they've been socially isolating, they've not been exposed to some of these viruses. So that's some of what's causing the pressures at the moment. So we use winter as shorthand, really, to describe how busy the system is. Just briefly then, most members and anyone watching will be familiar with this slide, which shows where we are in terms of deaths. The bottom line shows COVID deaths. As you can see, those are at a very low level. Vaccination and new treatments available to the NHS. So even if people are admitted with COVID and are admitted to intensive care with COVID, we have better treatments available. And so we are definitely seeing fewer deaths due to COVID. We've only had one in the recent period. Overall, when you look at the number of deaths, including all deaths, compared to the period 2015 to 19, it's generally quite a positive picture in York, and we've certainly seen a fewer number of deaths in York than some other areas I've seen, which is very positive. On to the next slide, please. So the committee, I understand at the last meeting, asked for a breakdown in the age range of cases. So what you have here is 5-year age bands with rates per 100,000, but also the number of cases. So in the graph that you can see at the moment, we've got 21 positive cases of children of primary school age, 42 of secondary school age, and 246 of university age range 18 to 21. That doesn't necessarily mean that the 246 are all students, but that's the number of cases in that age range. And so, as you can see, we're seeing even though we're seeing cases across most age groups, they are much smaller numbers in the older age groups. We're seeing the largest number of cases in children and in younger adults. And that is largely linked to vaccination. Children at the moment aren't eligible for vaccination, and for over 18s, kind of that 18 to 25 year age group, they've only recently become eligible for vaccination. And so that's one of the reasons why we're tending to see higher case numbers in those age groups. They also tend to socialize more. And if we're talking about that younger adult, they tend to work in hospitality, industry and retail, etc., where they're being exposed to more people. So therefore, they have a higher risk of infection. Just as today, Chair, the most up-to-date figures, we have 107 children of primary or secondary school age that have tested positive, and that's across 34 schools. But of course, that is having a massive impact on schools because those are the number of children that are tested positive, but it means that there are a much larger number having to stay home and self-isolate. And I'm aware of one school today that has had to make the decision to close to all but key worker or vulnerable children. So that's just to illustrate the tremendous pressure that our schools are under at the moment. In terms of care homes, we have 4 care homes with confirmed COVID infection at the moment, either a staff member or resident. The latest outbreak was on the 2nd of July. That was 1 care home. And we've had 1 recent care home death that isn't reported in our figures at the moment, but probably will be the next time they're refreshed. So that kind of hopefully gives members a kind of better picture of how the pandemic is affecting different age groups. On to the next slide then, please, Richard. So this is here just to illustrate really the performance of our local contact tracing service. The faint blue line is, if you can see it, which is around the 14th of April, denotes when we started to do all our own contact tracing in York. Local O, as it's called, because it means that we pick up positive COVID cases without having to wait for NHS Test and Trace to refer them on to us. As you can see, performance since then, the black line has been quite consistent. But what I think is really striking is the red bars. So up to that time, as you can see, we were having to do a significant number of home visits where the National Service had been unable to contact local residents. From when we started doing the contact tracing ourselves, that has made a significant improvement. And as you can see, there are far fewer home visits now needing to be done because we can't get in touch with people over the telephone. So that's really positive. On to the next slide then, please. That kind of shows where we are with our contact tracing. And as you can see, really high performance there. Just a small number, the green line at the bottom, of the number of cases we're unable to contact. For all of the cases that we're unable to contact, the service does a home visit and pushes information to the door. There are various reasons why we may not be able to contact people. They may be in hospital. It might be that they've gone to stay with relatives to care for them. Or it might be that people are not following social distancing rules and they're out and about. But there are few of those, as you can see. On to the next slide then, just to show what's happening with vaccination. So this shows vaccination uptake across age groups. As of yesterday, a total of 83.6% of adults in York have had their first dose of the vaccine, and just under 60% have had their second dose. So that's when we look at the totality of the adult population across York. As you can see from that, the take-up of the vaccine has been very good by and large. And as you can see, we're still playing catch-up with those younger age groups there. There's a lot of work going on across the city with the NHS, public health and other council services supporting the rollout of the vaccination programme. And then just to close, Chair, the final slide, just a reminder really of the announcement from the Prime Minister today that in fact legal restrictions will be lifted next week on the 19th of July. All legal restrictions will be lifted apart from the legal duty to still quarantine if you're returning to the country from red list areas or if you test positive for COVID. But a strong message from the Secretary of State that we should still be cautious and hand washing, good respiratory hygiene, fresh air, ventilation, face masks are still important. And we will certainly be strongly recommending those measures in York, but they will obviously be voluntary, not mandated from the 19th of July. So that's my update, Chair, but obviously happy to take any questions.
Thank you very much for that. That's been really helpful. And thank you, as always, to yourself and all of the public health team. I'm sure that, as you mentioned, the NHS staff are tired and have been working very hard. I'm sure your team is probably feeling similar as well. So it is very much appreciated that all that you're doing. I'm just going to note that Councillor Norman, during that presentation, sent a message to say that he was sending apologies. So we're not expecting him to arrive. And I can see 2 hands up for questions. I thought, as I was listening as well, I didn't mention before, because obviously we're used to Zoom hands and physical hands for supplementaries or what have you. So if you get my attention, I'll assume that you're asking a substantive question. If it's a supplementary, if you want to just sort of indicate that it's supplementary or actually just shout out to me that it's supplementary, and I'll try and bring you in as I can. So I saw Councillor Rowley first and then Councillor Musson, and anybody else, if you just indicate.
Thank you, Chair, and Sharon, thank you for your very informative presentation. I have two questions, and I think I know the answers to this. So the validated numbers, they would be on the, not on the lateral flow test, they would be on the PCR test. Yeah, because I was aware, as I'm sure you were, of some of the issues with lateral flow testing, and that some of the school-age children that were using not the correct forms of liquid. Apparently, fresh orange juice will give you a positive result on the lateral flow tests. Anyway, that's so I'm assured it was definitely the PCR test that gave us. Yeah, I thought it was. And my second question is, and you've kind of covered it with your slide there. So of the positive tests that we're seeing in Europe, you've given us an indication of what those age groups are. Do you have any information as to whether they are vaccinated or non-vaccinated? And again, in terms of the hospitalizations, vaccinated or non-vaccinated? Thank you, Chair.
So on the first question, I can give you the breakdown of PCR and LFTs if that's helpful, Councillor Rowley. Yeah, so if you have a positive lateral flow test, you need to go and have a PCR test to confirm that result. And if the PCR is negative, that overrides the negative, the positive lateral flow test. So our numbers get adjusted to take account of that. So there is a robustness, if you like, of our positive figures. In terms of our positivity rate at the moment for PCR, we're looking at 14.37% positivity for PCR. That is significantly higher than the national rate, but it's about the same as the regional rate. In terms of lateral flow tests, our positivity is 1.27%, which again is higher than the national rate, but similar to the regional rate. The difficulty we've got with lateral flow tests is not everybody records their result on the system. So there's a little bit of, they're not that reliable, if you like, because it relies on people inputting their result in. So that's the issue there. In terms of vaccination, hospital admissions, cases, we don't have the information at the moment as to what proportion of those are single or double vaccinated, or if they're not. The anecdotal information from the hospital is that they're seeing a mixture. And that's really because even if people have had 2 jabs, no vaccine is 100%, and people have different levels of immunity after they've had 2 vaccinations. So there are certain groups of people in the clinical at-risk group, for example, or older people where their immune system may not develop as many antibodies. But generally, they're less sick. And so they're less likely to get seriously ill and less likely to die. So even though the vaccination isn't 100% effective, we still strongly encourage people to have that. At the moment, the hospital doesn't have a system for routinely collecting that information, and neither does the NHS. But every director of public health across the country is asking for it, because we need to have that information. So I'm hopeful that we will get that data, but at the moment, unfortunately, we don't.
Thank you for that. Councillor Musson next.
Thanks, Chair, and thanks, Sharon, particularly for the breakdown of the aids in the presentation. It's really helpful to see that. I was wondering if you were aware of any schools further to Fulford School that might take the decision to go back to online only, given the peak of cases that we seem to be approaching. I hope we're approaching the peak or have reached it, but there you go. And just to follow up, well, it's not really, it's a separate question. To your knowledge, has there been any modelling that would determine what vaccine take-up point we have to reach to get to a sort of wane in cases, appreciating that that could be affected by all kinds of things like transmission vectors, return to workplaces, change in regulations, and if so, how far away might that point be?
Good questions. So the case numbers I shared with the school age children, that data's across 34 schools, I believe. So that is causing very significant pressures, as you can imagine. I can tell you how many schools it is. I've got it here somewhere. Yeah, 34 schools. Schools are under enormous pressure. They've got, staff off sick, staff having to self-isolate because they've been pinged by the NHS COVID app. They're under a lot of pressure as a result of that. The school you mentioned, I have spoken with today. They are dealing with a significant number of children now off across most age groups. And so the conversation I had with them today was about the feasibility of really closing and moving on to online teaching and being open for vulnerable children and children of key workers. So that's something that I know Fulford School is considering, and no doubt they will be writing out to parents to notify them of what they're intending to do about that. So schools are under enormous pressure, and that pressure isn't going to lift before the holidays. So that's having quite a big impact. In terms of the modelling around vaccination, yes, we have that detail. So we work very closely with GP practices across York. We have ward-based information which gives GP practices the details of the shortfall in each ward and the number of people they need to vaccinate to get those figures up to kind of 95%, which is really where we'd like them to be. We don't tend to publish that information because it changes daily. But I can assure you that we have that information and that modelling is there. And if any members are interested in receiving that detailed information for your own wards, then I'm sure we could find a way of providing ward councillors with that information.
Thank you for that. Councillor Hollier was next.
Thanks, Chair. I've got a couple of questions, if that's okay. So the first one was just, as far as I can understand it, the government strategy now basically is to not worry so much about the number of cases because there's an expectation that it won't, from where we are at the moment, overwhelm the NHS. I guess what keeps me up slightly is the thought that a large number of cases ongoing gives a greater opportunity for mutations, for new sort of variants. I guess, is there any reassurance in the kind of maths or generally that is unlikely, or, you know, how sort of likely a concern that should be?
We have no assurance. So the larger the COVID case numbers, so the more, the more prevalent COVID is amongst the population, the more cases we see, there is a significant risk of further variants emerging. So that is a significant risk, which is obviously being monitored very carefully by Public Health England. But yeah, there are a number of variants under investigation at the moment that could become variants of concern if we start to see outbreaks associated with those variants. And so, you know, we've saw the impact of the Alpha variant, the Kent variant, that had a massive impact on our case numbers in York and in other parts of the country, kind of end of December, January time. It's the Delta variant that is causing the difficulties that we have at the moment, but it's entirely possible that another variant could emerge. So I'm afraid I'm not able to give any assurance to elected members or residents that that won't occur in York.
Okay, thank you. And then my second question, I guess, was, I guess the government, with these new sort of announcements, is moving the, I guess, the burden from the state and the legislation to the individual to make choices. How you can make a sort of choice for how safe you feel for somebody else, because I guess in the case of masks, it's as much protecting other people as it is protecting yourself, perhaps more protecting other people. Is the sort of point of wearing them. I guess, do you have any advice, you know, if I'm trying to be a good citizen, in what sort of environment should I continue to wear masks, you know, even though the government doesn't necessarily mandate it?
Yes. I think that we're heading into a really tricky phase of the pandemic, because up to now we've had those, we've had the government guidance, we've had the regulations that we've been able to enforce, and as a council we've been able to enforce those measures where we've needed to ensure that environments are COVID secure. There will be many people who will be celebrating today's announcement that are really excited that restrictions will be lifted, and you know, we'll be celebrating that. But there will be, I believe, a greater number of people who will be very anxious as a result of all restrictions being lifted. And I'm particularly thinking of those people who are clinically extremely vulnerable, either for medical reasons, or they may have disabilities, for example, who will be particularly concerned about this. What we're working on at the moment as a council with all of our partners, including the business sector, is some citywide messaging that really tries to emphasize the respect and be kind to others. So we, even though we can't enforce this, we'll be recommending hand washing. We'll be recommending the use of hand sanitizer. We'll be recommending that businesses, retail, etc., continue to have hand sanitizer available. We'll be recommending good respiratory hygiene. It's not just COVID we need to worry about now. There are other respiratory viruses circulating, and as we get into September, October, and seasonal flu season, we need to be concerned about that as well. So, you know, catching coughs and sneezes in a tissue, disposing of that tissue, regular hand washing is just as important for flu and other respiratory viruses as it is for COVID. fresh air, ventilation continuing to be very important, meeting outside if you can, and the wearing of face coverings or face masks in crowded areas, particularly indoors, where social distancing isn't going to be possible. We'll be strongly encouraging those measures. We're also working with events organisers at the moment to determine what our message is going to be around regular COVID testing. So it's up to venues now whether they ask for proof of a COVID test, negative COVID test before events. So we're having those conversations now about how practical and how realistic it might be for events organisers to ask for proof of a negative test, but certainly we'll be strongly encouraging people to be responsible and to make sure that they have a negative COVID test before they go to an event and mix in with other people.
Thanks, Sharon. I've got Councillor Fenton, then Councillor Pearson, and then I'd like to sort of wrap this section up in the next 5 or 10 minutes. So Councillor Fenton, please.
Thanks, Chair, and thank you, Sharon. Just on it was interesting you mentioned the sort of discussions with businesses and hospitality venues about messaging going forward. I think that's good to hear, because I think there is a risk of those people who are concerned, a potential sort of new wave of isolation, of people self-isolating because of uncertainty and because of fear, really, about others perhaps not taking that cautious approach. So it will be interesting to see how that pans out. And I think, well, obviously the council will and does have a role in that, and it should be interesting to see how that develops. Just, you mentioned the point around work with GP practices in terms of making vaccination more easily available and hopefully tackling vaccine hesitancy. What good news, if any, can you tell us in terms of what's happening? I know just when I was out and about at the weekend, I saw a queue coming out of a doctor's surgery and wondered what it was, and then it became obvious it was people queuing to get a jab somewhere other than a mask and bar, which was encouraging to see in terms of that being available in the community. So are we seeing positive developments in terms of access to vaccinations?
Yes, I'm conscious of time, so won't go into details, Chair, but all of the work that's going on. The Outbreak Management Advisory Board had an update last week on all of the detailed work that's going on around this. For anybody who's interested in watching the webcast of that. But yes, I can assure you that there is lots of work to address vaccine hesitancy. What we're finding is that when we have one-to-one conversations with people, which is what is happening at the moment, there are often very practical reasons why somebody hasn't been vaccinated, access issues, for example, or misinformation. You know, they've read something on social media, and you know, we need to address those queries and allay any fears that they may have. But vaccination is voluntary, and so we know that for some people it is a conscious choice for them not to be vaccinated, and we need to respect the right of individuals to make that choice. But we're seeing little true vaccine hesitancy. The majority of people, when you make it easy for them to be vaccinated, so the pop-up sites, you don't need to book, you don't need an appointment, you know, you can just turn up, is definitely making a significant difference. And as you could see from the slide I shared, across most population groups, we actually have quite a high uptake of vaccination in York, which is, you know, really important. And we're already planning for winter, the COVID booster vaccination, flu vaccination, etc. So the work around vaccinations is going to continue. It's not going to stop.
Thank you. And just anecdotally, I was up at Askenbar last week having my second COVID jab, and there was a big long queue which was moving very, very rapidly. I was impressed by that. But also what was really nice was somebody had gone with their friend who was clearly quite anxious about having a vaccine, and the volunteers were great with the reassurance and all of that. So, you know, I think it's really good to see that where people are a bit hesitant, there is lots of support there for people to try to, you know, be able to have that vaccine if they can. Councillor Pearson.
Thanks, Chair, and thanks, Sharon, for your presentation. And it's lovely to see everyone in person again. And well done to all the team for putting up all these things for us. I've got a couple of questions really. One is around testing. What advice you would be giving to residents on how often they should be getting tested and what symptoms they should be looking out for. And I ask that with a view that I've seen something floating around social media where people who've had 1 or 2 jabs are getting slightly different symptoms when they're catching COVID. I just wonder if you could talk around that. And the other question was more generally about other health implications of the pandemic and how you think we're doing sort of a year and a half, 18 months on from the start of the pandemic, on things like mental health services, which we know took a real hit during the first wave, especially.
Oh, I probably don't have the time to give a really full answer to all of that. But briefly, testing, the message hasn't really changed. Asymptomatic testing, we're still recommending that people should test themselves twice a week, you know, 3 to 4 days apart. And, you know, that should be routine. And everybody should just get into the routine habit of doing that. Our testing strategy has changed a little bit in response to a change in government policy. So we still have assisted testing available with the council's testing and contact tracing service. But we're moving away from the big venue like the stadium that's now closed. We've scaled back the testing capability at the universities, although we can scale it back up again if we need it. But we're moving to door-to-door small venue testing, so working with the Explore and community hubs around testing and encouraging anybody who can to do their own testing at home, so people can collect test kits from our testing centres, from community pharmacies, and they can order them at home as well. So the testing strategy has changed slightly, but still recommending people be tested regularly. Obviously, if people have symptoms of COVID, they shouldn't do an LFT test, a rapid symptom-free test. They should do PCR testing, and that's still available. In terms of other health implications, I guess the major concern we have is around long COVID. We have done some modelling, which I'm happy to share with the next meeting of Scrutiny, this committee, if you would find helpful. So we've done some modelling looking at what we think the impacts will be of long COVID. And although in York, I'm not expecting us to see as high a number of COVID patients, because generally our population in York tends to be healthier, we will still see long COVID implications. But then there are also other knock-on impacts on mental health, a massive impact on people's mental health that, you know, and the modelling shows that. And then we're also seeing increases in domestic abuse, safeguarding concerns, and the impacts of people not having accessed routine healthcare during the pandemic. So where there may be untreated problems with blood pressure and diagnosed diabetes, you know, all of those issues, because there's such a backlog in routine prevention to pick up on. There's a concern about those impacts, and then the knock-on impact that might have on cardiovascular disease. And we've been doing modeling work, and as I say, I'm happy to share that.
Thanks, Sharon. And I'm just going to ask you one very quick final question, which I think sort of builds on that a little bit. So we've talked a little bit about the potential for case numbers to reach 50,000, possibly 100,000. I think they're the sorts of order of things that the Health Secretary has been talking about. And I guess when you get to that kind of number of cases, even if it's only 1% or 0.5% that require hospital admission, you're potentially looking at 500 or 1,000 cases a day, which is quite significant. But I think in your presentation, when you were talking about the non-COVID respiratory cases, presumably we might expect to see an increase in those as well if the restrictions lift. And I guess, without wanting to sort of put you too much on the spot, how concerned are you that the local hospitals could become overwhelmed if we were to see maybe not necessarily a COVID spike, but a spike in other non-COVID related illnesses?
It is a significant concern. You know, we haven't got a crystal ball, so we can't predict what is going to happen. But the work that's being done at the moment across the health and care system, not just in York, but across the wider system, is really trying to model worst case scenarios, so that we are as prepared as we can be to be able to respond to whatever might hit us, really. I think the biggest challenge we have is that when we were dealing with an increase in cases in different phases, previous phases of the pandemic, there were controls in place. And in fact, we had lockdowns which brought those cases down. We don't have that now. We have, you know, we're trying to deliver business as usual to as much as we can. We're trying to pick up on some of the elective treatments and preventative care that is the backlog from the pandemic. But I'm afraid that will end up being put on hold again. And so what we'll see is resources being redeployed to deal with the emergency of the situation in front of us, which we will do. We've demonstrated as a York health and care system that we can respond very effectively to those emergencies. But it just means that elective admissions, elective surgery, routine preventative health will have to go on the back burner again. And that will cause quite a lot of distress to residents, and, you know, will have negative impacts on the health and well-being of the population and on the health and well-being of staff, I must say, because, you know, we try and do our best. You know, we don't want to see waiting lists rise. We don't want to see hospital admissions rise. We don't want to see people struggling to access primary care. But inevitably, if case numbers rise as far as they're predicted, we will have to stop doing other service provision to be able to respond. And that is a realistic risk for us as a York system.
Let's hope that we don't reach the worst case scenario, because I think it's certainly quite a, don't want to use the word alarming necessarily, but it's a concerning picture perhaps at the moment. And I guess the next few days and weeks will perhaps give a bit more clarity to where it's headed. Thank you very, very much for your time this evening, Sharon. You're always welcome back at the committee, and I think you mentioned about bringing something back to us. It's actually September before we meet again, so I'll be in contact before then, and hopefully we have a healthy as possible summer. So if we don't see you before then, you know, I do hope you get a chance to have a break as well yourself. But thank you very much. So while you're cleaning the microphone, if I can just be asking Ian and Debbie to be coming to the other two, I suppose might be the simplest way of doing it. Thank you very much. So we're being joined for agenda item 5, which is the finance and performance outturn, by Debbie Mitchell, who's the Chief Finance Officer, and Ian Cunningham, who is the Head of Business Intelligence. So good evening to both of you. Thanks for joining us. So I guess probably Debbie, do you want to talk us through the report first of all, and then I'll ask Ian if you want to add anything to it before going to members for questions.
Yeah, I wasn't going to say too much by way of an introduction. What you've got in front of you is a summary report that provides a year-end analysis of the finance and performance position for the remit of this Scrutiny Committee. We've also attached as an annex the overarching council-wide finance and performance information that was presented to executive. So just briefly to remind you that the council did overspend in 2021 by 1.2 million, which admittedly was much better than we had been forecasting, and therefore we were required to draw down on some earmarked reserves. We fully utilised the contingency, and we used 500,000 of the general reserve. So that was the situation in terms of the financial outturn. That, in my view, was those reserves could be released without impacting on the financial sustainability and resilience of the council's overall financial situation. And I believe that was a prudent approach to dealing with those pressures. Clearly, the financial position was complicated, shall we say, in last year. There were a lot of different income streams in terms of COVID grants, COVID funding streams matched to different types of expenditure. But yeah, so we've set out the financial issues, and more detailed reports will obviously go to the various other scrutiny committees to look at their particular area.
Thankfully, Debbie's covered most of the things there. I'll probably just add a little mention around the performance data. It's obviously a lot of COVID-affected performance information over the last year, but the general trend actually been a pretty positive position for the indicators that come to this council, to this meeting structure, whether that be sickness data or processing information. Relatively positive picture still within the authority.
Thank you very much both. And I will just note, just before inviting questions, I think last time you were here, Debbie, we'd asked you about a bit more detail on the adult social care in terms of the mitigation, and actually there is a bit more detail in here, which is helpful. I think probably my next task will be something similar on the children's, because I think we've got the same sort of situation as we had last time, with quite a significant number of overspends, which if you top them up come to quite a lot more than the reported overspend without the mitigations set against them. So that would be helpful for next time. But over to members for questions. I can see Councillor Fenton's hand go straight up, so over to you.
Thank you, Chair. Thank you, Debbie. Just a question on page 12, paragraph 14. The underspending corporate budgets, which was achieved predominantly as a result of reviewing capital financing assumptions. I just wondered whether that was was that a situation that was unique to that year, or is that something that could potentially be a recurring source of underspend, or whether it was a sort of a lucky coincidence of various factors? Thank you.
No, there's no such thing as a lucky coincidence in my view, but anyway, that was, we did an early review of our financing assumptions in terms of when we would borrow, when we would throughout the year, and we also reviewed our minimum revenue provision policy, which is the amount that we set aside to repay our debt. There is an ongoing positive financial impact, and that was one of the budget savings that was included for the current financial year. So the budget that you approved, that Council approved in February, included a saving on treasury management. So what we in effect did was achieve that saving early so that we could generate some of that in the previous financial year.
Looking for any further hands, but I've got some questions if nobody else is wanting to jump in which case I shall. Ian, I just wanted to pick up, I think this is probably for you, page 12, paragraph 15, which is a kind of a sort of a summary overriding of sort of reporting of various things. And I had a quick look on the open data this afternoon and just found a bit of a mismatch between some of what was reported here versus what the data seemed to be showing me. And I just wanted to understand it a little bit more. So the sort of second half of the paragraph is talking about residents reporting the council are improving green spaces. Well, according to the Talk About panel, that number's dropped from 60% down to 44%. It has risen a little bit in the last 2 or 3 years from 37, but not that much. We've then got people using more sustainable modes of transport, but we've seen that cycling rates have dropped, park and ride rates have dropped, bus use generally has dropped, not just in the past year, but over a number of years. And I acknowledge that people are reporting that they're seeing the city as a safer space, but actually when you start to look into some of the crime figures for things like assaults and violence, those numbers have risen over the last little while. Likewise, when you talk about communities who report seeing drug dealing as a regular occurrence in their communities, that number's up to 20-odd%. And again, that's risen year on year over the last few years. So it's difficult to see how those bits of data tally with that summary, and perhaps I'm picking on particular things and you can say anything with statistics, but I just wanted to see what your thoughts were about that.
Okay, so I guess one of the questions, what you've been able to do there is you've taken all sorts of different bits that make up those indicators or indicator suites. And there are always bits within them, especially with some of the data sets you've mentioned, where it's not so much poor performance, but the trends aren't always the same. So a good example you gave there at the end was the crime data. The crime data is made up of 100 different types of indicators that sits inside of it. But I think most of the statements there, or the statements there, are a fair reflection really on the direction of travel. So if we look at crime and antisocial behaviour within the city, from my perspective, or from the data's perspective, actually rates have been very, very low and been reducing for the last 3 or 4 years. COVID has really changed that rate over the last year. It's been even lower, and levels have returned back, I think, to that gradual reduction. So I think that's probably a fair comment there. Described there about improving green spaces, and I don't have the figures in front of me, the 43%, 37%, but using statistically the last couple of data points for that, I think that'll be a fair reflection. Sustainable modes of transport is a tricky one, isn't it? I mean, we've had some discussion about that. It's been in the press. It's been talked about at executive around cycling rates and the reduction there. But against the baseline, actually, it's been a relatively positive position for sustainable modes of transport. And while we've described there park and ride figures and bus travel figures, not positive, I would put that probably in the context of all mobility data within the city, which has had a reduction over the last year. But up till that point, and of some of the data that we've got available, there looks like some pretty positive signs in the data around sustainable transport. So I think overall, the performance statements there are a fair reflection, but I guess there's always nuances to look into. And if we do have any concerns about any of them, I'm happy to provide the committee with some further details.
Okay, that might be something that we ask Economy in Place perhaps to have a look at then, certainly on the sustainable transport and that sort of thing, because I mean, certainly in terms of looking at park and ride usage, it's fallen year on year for the last 5 years. Cycling has fallen year on year, I think, since 2014. It's, you know, we're in a particularly funny period of time over this last 18 months of time, but I think it is really important for us as scrutiny committees that we have really clear understandings of what the data is telling us. And as I say, from my perspective, it jumped out at me slightly as it didn't ring true to what my residents were saying to me, and so I went and had a look at the data, and the data also didn't quite seem to pick that up. But I think you're right. If we dig into it in a bit more detail in the relevant scrutiny committees, that might be the way to handle that. Councillor Musson.
Thanks, Chair. I was actually going to ask the same question because shortly before being sort of rotated off housing scrutiny, we had the performance indicators, particularly around crime, which didn't seem to be looking to have improved. But the particular one that concerned me was that we'd managed to have an increase in hate crime over a period where people weren't even supposed to really be out and about that much and interacting. So I think it could be jarring for a resident to know or have a personal experience, hate crime over this period and actually not think that they think the city's a safer place. And I do think it's important that reports like this don't gloss over issues, even if unintentionally. There is a line in here saying, within the city, residents are reporting back. Is that based on a specific survey at all that this paragraph is kind of summarised from?
So 2 questions in there, and one around the hate crime. So while I can't give you an answer on the specific projects that have been put in place around it, I absolutely would agree that the main indicator around hate crime, which is cases reported into the police, has risen over the last year. And that probably be counterbalanced by the information that's coming through some of the surveys, whether or not that's the tenants survey or the talk about. I just don't have the figures available to me. The question around where does the resident survey responses come from? Why am I saying them in their general resident satisfaction? We base that on the Talk About panel. So the Talk About panel is a survey that goes out twice yearly to around about 1,000 residents. Okay, pretty high return rates, and moving forward, we kind of compare that against the other surveys that are being run at any one point within the council, but we actually use the indicator within the Talk About survey to go in here. The Talk About survey's just gone out to residents, so I'd hope within the Q1 finance and performance document, we should see a suite there. We should be able to get a greater understanding. We publish all of that data at a ward level as well, make that available on the open data platform, so we can look into any patterns and provide it to any of the teams or the departments within the council that would like to look into it.
Thanks, Ian. I'm looking for any further questions. I have some more, don't worry. But if anybody else wants to jump in, do feel free. I think I have another question for you, Ian, I'm afraid, although it may possibly come to you, Debbie, I'm not sure. It was page 14, paragraph 22, which was about the processing of housing benefit claims. And I think we've historically done fantastically well, actually, at processing claims, and the numbers have risen quite a lot, but from a very low, or the length of time has risen quite a lot from a very low starting point, but is still, I think, quite significantly below the national average, which is, a positive to hold on to. What I just wanted to check, and I don't know whether you would have this level of detail or not, is it talks about the performance having deteriorated partly due to the global pandemic and partly due to changes in the ways that ways of working, which I wasn't sure whether that was a reflection of changes of ways of working during the last sort of 12 months that are temporary and may go back to, revert back to what we were previously doing that was so good, or whether this is actually perhaps something that might be a more longer term systemic change, that we've changed the practice around how we process those claims, that we may now have to accept it being 4 days instead of 2 days, albeit that's still being below the national average.
Well, good question. Not sure I have a full answer for it. I think the absolute key that you've described there is actually there's been long-term fantastic performance in this area and very much below all of our comparators. And while there has been a rise up, although the data isn't available yet in the public domain, I mean, we've seen some kind of a little bit of return back in April and May within that information. Now, whether or not those rises are concerned straight to ways of working due to the pandemic, ways of working that partners have introduced, or just general ways of working in the system, I can't give you the answer on that one. I'd have to talk to the head of customer services, who's much more knowledgeable about it. And I can drop you around a note after the committee, but I can't be for sure which one of the threes that is. Okay.
I think it would be helpful just to have some clarity on that, because if it's a temporary change because of everything that's changed over the last year, that's one thing. I think if it was a longer term systemic change, we might want to just consider whether that's something that we're comfortable with or not. But as you say, it is right to note how good that performance has been there. Again, looking for anybody else. Councillor Rowley, fantastic.
Thank you, Chair. Thank you, Debbie. Just a question generally, really, and not so much to the report. Obviously, the government's support will be phased out, and we've heard this evening that the restrictions are going to be lifted next week. The business rate relief holiday has ended, and business rates now from June onwards are being collected. Just really a general question. What are your thoughts in terms of the forecasts in regards to how effective we will be as a council without the government grants and support? And the second part of that question is in terms of our revenue income and revenue collection, how robust are we and how confident are we of the revenue income that we forecast?
So, yes, the restrictions being lifted, whilst positive for a number of reasons, does sadly mean that the financial support will start to taper off, and that has been incredibly welcome and incredibly useful in dealing with the increased costs of the pandemic, which sadly is still with us, the pandemic, and some of those costs are still with us. So that withdrawal of government grants will put further pressure on our finances. The business rate relief ending, clearly, whilst York has been really busy over the last few weeks, I haven't got any data in terms of business success or failure, and whether that will impact on their ability to pay their business rates once all the government reliefs have ended. So that's an area of concern. As part of our budget planning, so for example, for this current financial year, we didn't factor in any growth in business rates, which we would ordinarily, because we would ordinarily expect to see a growth in business rates. We didn't. So we've kind of tried to budget as best we can for what although we've never known when it was going to happen, we've always known it is going to happen. So we've always known that the relief is going to come to an end. So we've tried to factor as much of that as we can in the budget. In terms of the council's performance in collecting income, it's remained very good. We've remained very high, 98, 99% of income collected. Income that's not collected, that hasn't been collected, for example, commercial rents, it's on a repayment plan, so arrangements have been made. So I think we're very effective at collecting that income. It will remain to be seen, however, how fragile or robust our local economy the recovery is of our local economy, because that's not something we know. We've tried to budget as best we can and taking the best approach that we can to have a realistic estimate of what income we expect to collect. And we're just going to monitor that really, really closely as we go over the next few weeks.
Thank you, Debbie. We appreciate that. And my next question really is one of these, hopefully we won't ever need to, but are the council's reserves sufficient for us in the unlikely event that we see a reversal of our fortunes in terms of expected income and a second spike and the effects of whatever that might do? So just how robust are our reserves?
They are robust enough for the information that we have. I'd prefer them to be higher, but I always will want them to be higher. So they are sufficient at this point in time for the risks that we are aware of. However, as you see in the report, there are some underlying pressures within adults and children's social care. And if those pressures cannot be brought within the council's overall budget within this financial year, and we need to use reserves again this financial year, then that will start to create a cause for concern, and we would certainly need to reflect that in a future budget process. So it's stating the obvious, but I'll say it anyway. Reserves are there. They are there for a rainy day. Clearly, we've had a very rainy day over the last 15 months, but once they're gone, they're gone. You can only use them once. So we need to be really careful about using reserves without having a plan to resolve the underlying issues. So that's the key. Content to use them to deal with issues, but there's got, so we've got to have one eye on the future as well. So that they're fine for now. There's no cause for concern or alarm, but it needs to be kept under constant review.
Thanks. Did you want to add something?
It was just to finalise the point off around business startups and deaths and on the local economy. So we monitor business startups quite closely, and that was one of the indicators actually that bounced back quite quickly. So actually business startups last financial year were only slightly down on the previous year. So that's probably good signs for the city. It will be important to monitor business failures, business deaths, whatever way you want to describe it, but it's very difficult to actually get hold of that information. So that runs around 12, 18 months behind before it goes through the systems. But something we'll have to keep a very close eye on, where and what is actually struggling within the city.
Thanks. Councillor Pearson.
Thanks, Chair. Thank you both for your report. I just wondered if you would talk a little bit around your assumptions around inflation, because I think we've seen early indications are that this year we're going to have quite high inflation. I just wondered how that is factored into your budgeting process.
So we make an assumption around what we call a prices contingency, so an allowance for contractual price inflation. Again, that's a pressure in this year, a budget pressure, because, as I'm sure you're aware, prices for things like construction costs and materials, it's been well reported, hasn't it, those increasing costs of construction. We were anticipating a pay award, but one has been offered, so it's not been accepted yet, but one has been offered. So that's another pressure in terms of our budget. So again, we make the best forecast that we can. So we have built something in. It won't be enough because I think a combination of Brexit, the Suez Canal and COVID as all, whichever one of those particular reasons you prefer to choose, has seen that increase in cost, and that certainly we didn't factor that amount in. There is always the option, of course, to pause projects if it's a temporary increase in costs, but I don't think we're at that stage yet.
Thank you. Again, I've got a couple of questions, but I'll just keep an eye open for hands going up as well. On the children education communities, I appreciate that you probably won't have the level of detail that I might want to get to, but I just wanted to double check that I'm in the right ballpark and my understanding is correct. So similar to what I did with adult social care last time, I've sort of done a tot-up of what I think are all the overspends that are recorded, and it comes to a number that's somewhere between I think 10 and 12.9 million, but then the reported outturn overspend is more like 3.8 million. So I presume that there's quite a lot of things that go on within the department to sort of offset overspends in one area with a saving elsewhere. Would I be right to think that the Reducing Services Costs Board is where that's all managed? And do you have a role within that, or is that something that somebody from your team has a role within? Because I'm just wondering whether the way to get at some of that detail might be to ask them to go and speak to the Children Education Community's Scrutiny Committee, you know, rather than us kind of all speculating here this evening without necessarily all the information.
Yeah, the Reducing Service Cost Board does have finance and I think procurement representation on that board. I don't attend that, but I'm sure a member of the team does. I do normally go through and add up to make sure I've included everything. I wonder if in your totting up you've included the DSG deficit, which would be separate. That's a separate ring.
I didn't include the existing deficit.
Oh, right, okay.
I just totaled up where it said overspends. The one area that I had a query on was around DSG, and it was whether in fact, I'm not going to go into the full detail of it because it's probably not that exciting for everybody. There was a 2 million and then there was a 4 million figure, and I wasn't sure if the 2 million was part of the 4 million, which is why I said between 10 and 12 million.
Right, yeah. Well,
but even by the lowest figure, you're still talking 10 million with a 3.8 million reported, so it's a 6 million difference.
But the 3.8 million, sorry, I should make it a bit clear in the report, is just the general fund. So the DSG is not part of general fund. So that 3.8 million doesn't include the 2 million or the 4 million.
Right.
So
okay.
It's a separate
that's helpful
account. And like I say, I'm sure it'll go into more detail at Children's Scrutiny Board. The DSG is a separate area. There's a dedicated schools grant that are passported through to schools, but that is under significant financial pressure due to the increase in SEND costs and reduction in funding through that route. So I'm sure that's something that Children's Scrutiny would probably, if they've not already looked at, I'm sure they will be having a look at. I'm not the right person to go into a level of detail about that, but I'm sure you know, Richard on the team knows all about that, so I'm sure people will be able to come either to this meeting or a Children's Scrutiny meeting to discuss that.
Well, I think that might be something that we might want to do as a committee, is ask Children Education to have a conversation with Reducing Services Cost Board as to whether they might be an appropriate group to speak to that committee. Sort of building on that theme, and as I say, I was really it was really good to see within the health and housing and adult social care a bit more detail around, you know, where the cost mitigations are. And there's a few references to the Contained Outbreak Management Fund, which I think was a one-off grant that's been brought in. Page 27, paragraph 46 states, though, that the underlying pressures continue, however, and then it sort of gives a whole series of things. And I guess what I'm just concerned at is, and I may be wrong on the figures here, so please do correct me, but I think it was a couple of years ago, the Outturn was suggesting about a 2 million overspend in adult social care, and an investment was made of 2 or 3 million, which brought it back down, and then it came back up again. And then we were looking at Q3, I think, was looking at a 2, 3, possibly more million overspend, and then it's now coming in as an underspend, potentially almost entirely as a result of this one-off grant. So how likely might it be that we'd expect to see an overspend, perhaps not next year, but the year after, if we're looking at this kind of continual around about 2 million overspend in adult social care?
I absolutely expect to see an overspend in adult social care in the current financial year. The use of the Contained Outbreak Management Fund was one-off. Significant number of the costs in social care were related to the COVID pandemic. That's why we were able to use the Contained Outbreak Management Fund to cover some of those costs. Again, I'm sure you may want to ask the Adult Scrutiny Committee will, I'm sure, want to look in a lot more detail at that, but we're seeing increasing complexity, increasing costs, the impact of long COVID, the increasing number of mental health referrals, a whole host of things that I'm sure you're familiar with that are coming together to create further pressure in adult social care. So whilst the Contained Outbreak Management Fund, you know, was a solution in last financial year is not going to be a solution. It's not a permanent solution. I think, as I've probably said, pretty much every meeting I've ever attended, permanent solution requires national government to sort out the long-term funding solution for social care, because it can't continue to be council tax and business rates. So until that is resolved, the fair funding review, the business rates reset, all that, which I think is pushed back, understandably, it's not pushed back to 23, 24 potentially, but until we've got that national discussion on the funding of social care, my view is we are going to continue to deal with it year by year, because the current funding is not sustainable given the increase in complexity and numbers. Some of this is as a result of COVID, so the impact of long COVID, particularly on more vulnerable, and also the increase, mental health, the next pandemic, I guess, but those increased referrals and the pent-up demand as well, due to services not being available during the pandemic. So all that coming together is not something that's unique to the council. It's pretty much every social services authority in the country is, I'm sure, experiencing a similar sort of issue, and it's not something that we can resolve permanently within the funding that we've got available to us, given the restrictions on increasing council tax. We don't even set business rates, so we've limited ways to generate income and increasing costs. And so there's only certain things that we can do on that. So I think we'll continue to go year by year until we will get a comprehensive spending review in this year. Possibly not. We might just get another 1 year and then.
And I think, and I'm not just saying this because Councillor Rowley's left, though he did say to me that he had to leave for a parish council meeting at 7 o'clock. But I think the remaining elected members around the table, I'm sure we would all agree that actually more funding for adult social care from local government is desperately needed. And in a way, you're not telling me anything that I don't fully agree with. I think my only concern within this, and I think it was really helpful to have it clearly allocated, clearly marked out in the report to say, this is where this one-off payment has been spent, this is where this one-off payment has been spent. And I think the worry would be that it, at face value, appears like all of a sudden, magically, we've fixed adult social care, and actually, in a year or two's time, we'll be back in the same position again. So it's helpful to have you set that out. And I think, as I say, those of us left around the table, certainly, and possibly Councillor Rowley as well, I don't want to speak for him, would all be looking to national government to get its act together on that. I just have one final question for you, unless anybody else has any other questions that they wanted to jump in before me on, which again, you may or may not be able to give me the answer to. It's to do with the housing revenue account, page 31, paragraph 67. And I just wanted to better understand the figures just in that paragraph. So the year end was an underspend of 3.25 million, and that was basically because of the difficulties of going on with work during COVID and what have you. And 2.3 million of that was just slipped into the next year. So presumably that means that the work that couldn't be done this year will be done next year. The bit that I didn't quite get was the adjusted year end position surplus of 89,000, which is then an underspend of 914 compared to budget. Now, is that because we were anticipating a significant overspend that we haven't overspent, and that's what the underspend is? Or is that money that's not been spent and nor has it been transferred onto next year and therefore won't ever be spent?
It would be easy to explain if I had a copy of the housing revenue account in front of me, but I don't. But essentially, as you know, the housing revenue account is a ring-fenced account. Expenditure and income, they should balance. They don't. For 2021, they didn't balance off exactly to zero. They resulted in a net cost of 825,000. What that meant was we were spending 825,000 more than we were getting in. And so that was the balanced budget, if you like. That was the agreed position. But the outturn was a surplus of 89,000. So that it wasn't a cost, there was a small surplus, which explains the 914. It can't have a planned net cost every year, because then that's dipping into its reserves. And the same conversation we've just had about general fund equally applies to HRA. but they've got a bit more flexibility between years, so they can have a cost in one year and a surplus in the next year. So it's just, yeah, how it worked out. I haven't got to hand actually what the current year's net budget is, but ordinarily the net budget would be nil of the HRA, but just occasionally, depending on what's happening, there'll be a small net cost or a small in-year surplus, and that will all get rolled into the HRA balance. So they would either draw down some of that balance to fund that year if there were extraordinary costs in that year, or they would, you know, add to the reserve or use it as they see as required.
Yeah, so it's not that money that could have been spent hasn't been spent as such. It's that it's a little bit of a peak and a trough,
Yeah.
and last year was a bit of a peak, this year's a bit of a trough, and overall over say 5 years it would be a net zero.
It reflects that life doesn't happen between 1st of April and 31st of March, if that makes sense. Not everything stops on the 31st of March and starts on the 1st of April, so it accommodates sort of timing differences between years.
Okay, thank you very much. Unless any other members have any further questions, I'm done. That's been really helpful. So thank you both very much for your time this evening, and feel free to leave. And if we don't see you before the summer, have a good summer, but we may well see you. Thank you. Just before we move on from that agenda item, so I just made a couple of notes that we might ask the Economy in Place Committee to have a look at the sustainable transport figures in a bit more detail, and also the open spaces and satisfaction and what have you in a little bit more detail. And that we also might ask the Children Education Communities Scrutiny Committee to seek to engage with the Reducing Services Cost Board with a view to getting a bit more detail on the sort of overall balance of that budget there. So if everybody's happy that we make that as a specific formal request to those two committees, I think it's probably the best way to do that. Seeing nods from people, everybody happy that we do that? Great. So if I could ask you, Rob, just to pass that on to those two scrutiny chairs, that'd be really helpful. Thank you. So I'll move us on then to agenda item 6, which is just to note the work plan for the various different committees. I will note that we haven't got our work plan in this lot, so apologies for that. That's me spending time getting everybody else to get theirs and then neglecting to get our own in place. So when we next meet, I will see that we have got something similar with a bit more of a longer term plan set out. What you see before you is the result of all of the other scrutiny committees having had forum meetings over the past month with various executive members and corporate directors, and you may recall I'd asked them to set out a sort of a skeleton framework of what their next year would look like. So it's not that this is 100% set in stone, but this is a sense of where they will be going. Obviously, we meet more regularly than they do, so I think we'll probably retain a little bit of flexibility in what we're up to. But I would welcome from members, not necessarily right here and now, but if members have any particular areas that they'd like to see this committee looking at over the next year or so, please do feel free to email myself and Councillor Fenton, and we will try and take those into account when we're looking at what our work plan looks like for the next municipal year. So unless there's any questions on any of that, that takes us through to agenda item 7, which is urgent business. And I don't know of any urgent business, which then just leaves me to thank you all for your attendance this evening, and thank the technical staff and the staff on either side of me for your attendance this evening. And we can close the meeting and hope that you all have a good summer if I don't see you before the next meeting in September. Thank you very much.